the IRA is obviously a huge trend, and making sure that language around that in your contract is clear, concise, and protects the plan. Um, the impact is going to be in the rates and the rebates. We're losing rebates on those drugs. Manufacturers are no longer offering a rebate because the price of the drug is so discounted. So, as of now, as of the first year, and when these go into effect, there will be no more rebates. So what's going to happen is the PBMs won't be able to meet their rebate guarantees, so they're renegotiating rebate guarantees. So your rebate guarantees are going to be less depending on your usage, how big your plan is, and so forth. But that is a huge impact because a lot of plans depend on those rebates in the back end to offset all of their costs. So losing those rebates is going to be a huge impact, and making sure that you have the language that doesn't allow the PBMs to open up that contract or trying to think of how I want to say this, but to let them renegotiate those rebate guarantees just from something other than the manufacturer or the negotiated fair price drugs, some other kind of market event. You want to make sure it's very clear. These are the 10 drugs that we're losing rebates, and this is what's causing this, and so forth. Because of that, because of the IRA and these negotiated drugs, we've seen other drugs, which are not negotiated drugs, also start to decrease their prices. Decreased prices means decreased rebates. So it is very complex, this language. I've seen a whole bunch of different proposed language for contracts. Getting to what's right for you and protecting your plan is what you need to do, just to make sure that they're not negotiating just because one drug, had something decrease its price. It needs to be a market event. It needs to be a certain percentage of lost rebates, not just, hey, Januvia decreased. Let's go renegotiate our stuff again. So that's where the IRA and all of this is impacting. And then our biosimilars, same thing. So biosimilars, depending on if the PBM's formulary has low WAC, high WAC, their branded biosimilar, you may or may not lose some rebates there. And it just depends. You got to work with your PBM on that too, but making sure your rebate language is just really clear, really tight around all those market events. And so I have seen PBMs put in their contract any market event that accounts for a 1% decrease in rebates can mean we can open up to negotiations. And that's not enough. You have to have a bigger market event than that, right? Because the minute you open up that contract and the minute you're doing renegotiations, everything's fair game, right?